Oh, this is great. So this is an article about how we know when we can all kind of start going back to quote unquote normal. Like what should be the mile markers for when we can kind of get out of this wartime mode. So let's see. What do experts think? So, okay, this is a report by Scott Gottlieb, blah, 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 a bunch of people who, let's take a look. Let's see what this report's all about before we get into the summary. This is a report by a bunch of PhDs, lawyer, masters in public health, and doctor, American Enterprise Institute. Okay, it's a pretty legit organization, I would say. So they did this roadmap to reopening. And now let's go back to the news article that conveniently summarized the takeaways for us. What do they think we need to do? First, the hospitals have to be able to safely treat all patients requiring hospitalization without resorting to crisis standards of care. So this is probably the most important one, which is, if your hospitals are overflowing. Anyway, so the point is, like, if your hospital can't handle the current crush of patients, like if you're in New York City, then the last thing you want to do is say, okay, everybody go back to work, back to normal, right? So that's obvious. Seems like very sensible. So the first thing we should do is wait till our hospital utilization is closer to 80, 85%, I would imagine, and where you're not having like field hospitals and hotels and tents and things like that. The next thing you want to know is a state is able to test everyone who has symptoms. So I think this is kind of like that South Korea model, right? Where, I know the president has said in the past that anybody who wants a test can get a test. I think he was being quite cunning because at that time, the U.S. guidelines for getting a test were like you had to be showing symptoms or be in a high-risk group. But I think what the American Enterprise Institute and the South Koreans are saying is like, no. You should test everybody that has like even flu-like symptoms as early as you can to kind of get in front of it. And you want to be doing about 750,000 tests a week in America. This is viewed as a reasonable expectation for when we haven't been having any major pockets or regional outbreaks. So the question is, like, currently, how many coronavirus tests per week in USA? So right now, we're at about 100,000 a day. Many are denied tests or must wait several days for results. So there's a big backlog. But, the number is about 100,000 a day right now, which is great because that would put us at 700,000 a week, which then, according to, if you believe the AEI, the American Enterprise Institute, would put us just under 750,000 a week. So we're under where we want to be, but we're getting closer. Of course, the question for the retrospective will be like, why? I mean, if we shut down flights to China in the end of Jan, and here we are in early April, and we're still trying to catch up with our testing backlog, like you wonder, like, what the hell happened there? Which we will get into momentarily. So again, just to recap, you want hospitals that can handle all patients without resorting to crisis standards. Then you want to be at about 750,000 tests a week. There will be times where we need more than 750,000 a week, but let's get to 750,000 a week. And then the state is able to conduct monitoring of confirmed cases and contacts. So a robust system of contact tracing and isolation. So I actually have in-laws in Singapore, and that they are pretty hardcore. Like when they order you to isolate, like they do these random checks. You have to install this app, and you have to do a live video of your surroundings if they require it. They actually come and knock on your door at random. Like it's sort of like almost like an IRS audit. And then if you're caught like jumping isolation, like it's a $10,000 fine or something. Obviously, that's not the American way. But I guess what they're saying here is they want really strong monitoring and confirmed cases. Other countries have relied on cell phone tracking. We don't have anything like that, and not clear that we'd be okay with it for privacy reasons. So I'm not sure how we're going to do it, but they're saying we need more monitoring of confirmed cases and contacts. And then you'll want to see a sustained reduction in cases for at least 14 days. So the number 2, and I guess this one's number 4, go together. You got to be testing a lot, and then you want to see still a reduction in cases despite a lot of aggressive testing. And so we were looking at charts where we're like, hey, look, it's down. But those charts where it came down, other than like South Korea, they were only coming down for a few days or a week. They want to see a sustained reduction for 2 weeks. Okay. And I think if you have all 4 of those things, you're good to go. Then you can go back to this wonderful Times Square celebration. So in summary, if you believe the American Enterprise Institute, as summarized by the New York Times, you want hospitals that can handle patients. You want about a little under 1 million tests a week. And you want some way of contact tracing and enforcing lockdown isolation. If you do that, then there's a path. But here's an example where you wonder, like, if we have a presidential daily briefing, like, why isn't there a freaking plan? Why do I have to read this from the American Enterprise Institute? Why isn't Fauci and Birx and Trump and Pence and Jared, that brain trust? Here's the plan. This is what we need. This is what we have. This is how we're going to get what we need. This is how we transition to a more normal situation. These are the metrics we're going to be looking at. We want, this many cases per day, reducing at this % per day. We want to have our supply exceed our demand for this many days or this % utilization. And we want to implement these contact tracing things. I just say it. Have a plan. All right. That's another, you know about the petition, guys. So go ahead, check it out. All right. Let's move on to the next chart. This is not a chart as much as an interesting debate I had with someone on Twitter. And I just thought it was really interesting. So I'm going to share it with you.